Hi, my name is Avery Boudry, and this is my Women's Health Disparities presentation today. So we're just going to start off by answering what are women's or health disparities. We can define health disparities as health disparities refer to the differences or inequality in healthcare for different groups of people based on their race, ethnicity, gender, sexuality, and economic status. So this can be seen with access to healthcare, differences in conditions and certain diseases, and treatment options. So why do women's health disparities occur? So to kind of answer this, we think of the why is basically the what. So the what is we are lacking access to healthcare, we're having treatment problems, and that kind of occurs like with the socioeconomic status, and that goes into biases, because when we have biases, especially from healthcare providers, that makes it harder for people to A, access healthcare, B, get the proper treatment, and C, be listened to be diagnosed with the proper condition. We also have socioeconomic status, which is a problem. So people living in poverty, sometimes it's more difficult to find proper quality, good health care. So that can be a good cause for health disparities. And also environment and location. Some locations, healthcare just isn't accessible because there's not enough hospitals, or there's not enough people to fill those hospitals, and there's not enough healthcare for providers. So for equality and equity in healthcare, we're going to first start by defining equality. Equality is basically people are equal. So for an example, I said if I give you an apple, I also get an apple. So we both have one apple. Equality in health means that people are getting the same treatment and access to health and health care. So everybody's getting the same. The playing field is level. When we're talking about equity, equity is people are being treated in a fair and just way. So for example, you get one apple because you were full and you are no longer hungry. But I get 3 apples so I can feel the same level of fullness that you are. So then we're both now on the same playing field. So equity in health is when everyone can attain their full potential for health and well-being. So those who need more care are able to get more care or better care to be as healthy as they can personally be. So for our specific health disparity that we'll be talking about today is the mental health disparities in women. Women are more likely than men to have certain mental illnesses and health issues than men. This includes anxiety and depression, which were the 2 that we will be talking most about today. What we will be discussing is what is anxiety and depression, just a basic overview definition, why do more women suffer with these mental illnesses than men, and who is affected by this disparity. So because I'm a history major, I like to do a brief history of women's mental health, especially hysteria, as hysteria is kind of what is in comparison today would be anxiety and depression and kind of just overall women's health symptoms. So what is hysteria? Hysteria is a historical condition that women were diagnosed with if they did things that were not deemed acceptable behavior or behavior that their husbands did not like. It more or less was a way to get their wives to A, do what their husbands say, and B, if their husbands didn't want to deal with them for any given reason, they could claim hysteria and send them sometimes to mental institutions. So symptoms of hysteria, some common symptoms include chest pain, excessive emotion, increased or decreased sex drive, increased appetite, swollen abdomen, increased heart rate, or infertility. Treatment options for these can vary, but treatment options for hysteria involved pelvic massage, which would basically force the woman to orgasm and release excess fluid, which they believed would basically make women help release all these emotions and help them kind of reset themselves. They would also place leeches on the abdomen to reduce blood flow in the womb. And sometimes if a woman was too hysterical, they'd suggest that she get married. So to focus on our main part, this is depression. Depression is persistent feelings of apathy, sadness, hopelessness, inadequacy, and physical exhaustion. These symptoms and depression can be triggered by stress. They can come and go in episodes or waves, as some people have seasonal depression, and can coincide with other disorders. These other disorders can be bipolar disorder, stress and anxiety. Depression and anxiety tend to go hand in hand pretty well. And it is the most common mental health issue for women. Anxiety. Women have higher rates of anxiety disorders than men, but for the sake of this disparity, we're going to be talking about generalized anxiety disorder, which is the acronym for GAD, as a definition and guide. So GAD is the chronic and exaggerated worry and tension that lasts for at least 6 months. People with GAD may worry about disasters befalling themselves or their loved ones, or routine events of everyday life. So this type of stress puts stress on the body and can result in other physical conditions, why it is sometimes such a big problem and can cause problems down the line. Anxiety can also be caused by a a pre-existing problem, such as pain or a condition that's causing someone to have a lot of anxiety. So why does this happen? Why are there more women with this than men with anxiety and depression? So women are more likely to turn their emotions inward, while men are likely to turn their emotions outward. So this is more of a social and societal standard to where women tend to internalize their emotions and keep them to themselves, while men tend to show their emotions by expressing through anger or through self-medication. And so that's why these ones are more internalized and can manifest themselves in anxiety and depression easier. There's a fluctuation in women's hormones throughout her life. So these hormones can also trigger depression and anxiety through a woman starting her menstrual cycle, through premenopause, postmenopause, and even the hormones that a woman goes through during pregnancy and childbirth. So what causes anxiety, depression, and other mental health disorders? Biological factors. This can be as genetics. So if your mother has it, you can have it. Father has it, you can also have it. It's a genetic pass down within your genes. Hormones. Hormones are a biological thing. Women can't necessarily control them, and these can trigger these kinds of episodes of anxiety and depression. Substance abuse. Substance abuse can also cause anxiety and depression, as increasing substances can alter A, brain chemistry, and B, can also affect the overall physical health of a person, and even trying to quit. So substance abuse can be a big trigger for anxiety and depression. Injury, so any sort of like a brain injury can also trigger anxiety and depression. Social, stress from societal expectations. Women face societal expectations every single day. Some of them are moms that can have it all, and these moms are juggling a work, a home life, their husbands, or their spouse, and their children. And these everyday stresses can be a lot on someone, especially women, which can trigger this amount of stress and depression and anxiety that can overall affect them in their health. Economic, low income and other financial issues can place a great stress on a person. We know this economy is sometimes hard to live in. When you are in a low economic status or people with poverty, there tends to be higher tensions of paying bills on time, and that overall stress and anxiety can cause anxiety and depression. So let's talk about some statistics for who is affected. So clinical depression is 2 times higher for women than it is in men. In 2021, the prevalence of major depressive disorders and episodes was higher among adult females, which is 10.3%, compared to males, which was 6.2%, and that's from the National Institute of Health. In 2021 as well, the prevalence of major depressive disorder was highest among those who reported having multiple 2 or more races within them, which was 13.9%. In the past year, prevalence for women for any anxiety disorder was 23.4%, compared with 14.3% for men. So again, you're seeing that women having much more anxiety disorders than men are. And when looking through all the sites that I was going through and what I found and just trying to find some statistics, I kind of noticed a trend that with anxiety and depression, it was predominant in mainly white women and tended to be in the highest in the ages under 40. So typically the younger the adult was, the higher the levels of anxiety and depression were. So what can be done to help women's mental health disparities? We can break the stigma against mental health and create new societal norms. Sometimes in this world, there is that stigma that mental health is something that we cannot talk about, that is something not to be shown, and historically for women especially could not have been shown, henceforth being diagnosed with hysteria and other disorders, such as historically being the problem with no name. And so I think breaking down that stigma can help women, be more open about it, make it more accepting, and know that there are other support groups out there to help people, which is creating more opportunities for women to access treatment. We can make it more known that mental health is a problem, and we can make it more accessible for women. So free therapy for certain regions, making healthcare more affordable so that women can go get these mental health issues, and making more groups to discuss them, because some of these are women target problems that need women targeted solutions, which goes back into support groups for women with mental health issues, because sometimes it affects women differently than it does men. And that's just based on biological factors such as brain development and different things such as that. So what can be done to help overall women's health disparities? We can listen to women and their concerns. Healthcare providers sometimes tend to have a bit more bias towards women, or women can be deemed dramatic or have excessive emotion. What we need to do instead is start listening to women and their symptoms and start catching things early on so they don't become a bigger problem, which goes into decreasing biases. We need to put our biases aside, especially healthcare providers, so that we can provide the best treatment for our patients. Working on making healthcare more affordable. When healthcare is more affordable, people are more apt to go get healthcare treatment, such as therapy and, if needed, other methods such as prescription pills. We need to give quality care. Quality care is a big thing. Not a lot of people are getting quality care, especially in that mental health field. So we need to make sure that that care is quality enough for them to be able to overcome their mental health issues. We also need to do more research that specifically targets women. There has been more research within the last 50 or so years, especially compared to what it has been historically. But the problem is women's bodies and minds are different than men's. And we need to make sure that we're targeting those research aspects to specifically address women so that we know how to handle these things, because health is not a one-size-fits-all. We need to make sure that women are included in that. We also need to make treatment and quality healthcare more accessible. So make this treatment and quality healthcare more accessible. If there's not enough hospitals, make more hospitals. If there's not enough resources, make more resources. My references, and thank you.